Welcome to the question of the week. I'm Amelia, occupational therapist and owner and founder of Higher Standards Caregiver Training. And we're going to jump right into the question of the week today, which is actually a question that's in response to last week's post announcing question of the week, which was all about 2 ways that we can identify bed sores at early stages before they become open wounds. Before we jump into that real quick, keep in mind this is for educational purposes only. It's not a substitute for health or medical advice, and it is not a substitute for a therapeutic relationship. Okay, so the question of the week came in from pharmacist Patrina McCauley, and she had a question related to one of the ways that we can help to identify skin breakdown bed sores early on before there's an open wound, and that technique is blanching. And if you read the comments in that post when I posted that video, we kind of openly acknowledged and had a discussion that when people have different skin pigments, tones, and colors, that blanching response can look different and it can be harder to identify, especially when the person who is doing that assessment may not have experience or background with working with someone who has that skin pigment tone or color, right? So one of the things Patrina asked is if I could provide any guidance on how blanching looks on different skin pigments. So I'm going to do my best here. I did a little bit of research in addition to my own personal background in preparing for this question of the week, but I also want to acknowledge the fact that there are probably professionals, wound care professionals, dermatologists out there who know more about this particular topic than I do. So I would invite anyone who sees this, who has more information, to please engage in the conversation. Reach out, put in a comment. Maybe we can have an additional discussion about this topic together live so that we can make sure and provide the best possible information around these kinds of topics. So that said, I'm going to jump in with my best answer to this question. So blanching, again, to kind of review from last week's post. If you didn't see last week's post, it would definitely be a great idea to go check out last week's post about early identification of bed sores. There's some good information in there. But blanching, which is one of the techniques that we often use to identify early stages of wounds, bed sores, is, again, kind of to review, where you press down on the skin. And when you do that, it forces the blood out of that area of the skin, and it makes that skin turn a more pale color. And then as the blood comes back in, the skin regains its normal coloration. And this actually is a good sign. That's what we want to see, because that's what your skin is supposed to do. When we don't see a blanching response, that indicates that there's damage to that skin and we have a wound that has begun to form there. But this can be, as I said, it can be more tricky on different skin pigments, different skin tones, different skin colors. And certainly if we have limited experience working with folks who have those different skin tones and colors, different from our own background and experience, then it can be something that providers miss, right? Like just openly acknowledging that we can miss things when our own experience, doesn't allow us to see what is right in front of us. So what can we do though? The first thing to understand is that just because someone has a darker skin tone or pigmentation doesn't mean that you cannot necessarily see a blanching response. Although for some people, their skin tone pigmentation may be so dark that it becomes extremely difficult to do so. So we want to look for, it doesn't necessarily have to turn white, right? Like I'm a white girl, so my skin turns white during a blanching response. However, what we're really looking for is a change in coloration, right? So if you're not sure what that change in coloration should look like for the person that you're caring for, then one of the things that you can do first is, if you are the caregiver, then you probably know that person better than anyone. And if you are the provider, then talk with the caregiver, talk with the patient, ask them what they think is normal and what's not normal, because no one knows that person who's being assessed better than the person themselves and the person who is caring for them. So making sure that we are acknowledging the value of the information that people are providing to us about themselves and about the people that they care for, because we can't know them as well as they know themselves. Another kind of tip that you can use is if you can go to a area of skin that you know to be healthy and assess the blanching response in that area of skin that you know to be healthy, and you can see if you can see a blanching response in that area, then that can give you some good information about whether or not the potential area of concern that you're addressing is actually blanching or not blanching. Here's the other thing though. We never want to rely 100% on just one assessment, particularly if we are either not experienced enough to do that assessment properly with that person, or if that assessment is just not going to be a valid assessment for that person. So we always want to make sure that we're looking at the whole big picture, at all of the factors involved, all of the risk factors involved, and whether or not there is a potential wound forming. And when in doubt, always siding with this erring on the side of caution. That's what I was trying to get to. So let's see. Hold on. I had notes here. Okay, so one other thing that I wanted to share with you today, in doing some research for this, I found a cool article on PubMed through NIH, and I'm going to go ahead and link that article in the comments here. And it's all about some new technology that has been tried in order to eliminate this like blanching experience, this blanching bias issue, so that we can make sure that we are assessing everyone equally and the same and effectively. And basically what this study did was it took some infrared technology and it used different equipment in order to apply pressure, and using infrared technology was able to assess accurately whether or not there was a blanching response regardless of the person's skin tone. So I thought that was a pretty cool article, and it goes to show that, you know, when we are looking for different technology, different tools that we can use to help make sure that we are treating everyone the same, that everyone is getting the same access to healthcare and getting the same quality of care, that stuff is out there. And it's worth making an investment in. Okay, so that was my best shot at the answer for this week's question of the week. It was a pretty complicated one, but keep them coming. I'm also, so along with the link to that article, I am also going to be posting a link to submit a question directly using the question of the week response form. That way, if it's a question that you don't feel comfortable asking openly, you can submit it anonymously. If I get more questions of the week than I can possibly answer, I will do my best to link anyone who submits a question to the correct resources to try and answer that question as best as possible, as much as I possibly can. Until next time, guys, keep those questions coming. Thank you so much, Patrina, for that excellent question. And again, if anyone has more information about this, if there are any true experts on the subject matter who want to engage in a conversation about it, reach out. Let's talk about it more and make sure that we're providing the best information possible. Till next week, y'all, thank you very much. I will see you for next week's question of the week. Bye.